The DG West African Health Organization, Professor Stanley Okolo, joins us right now to discuss this. Many thanks for joining us, Professor.
Thank you so much.
Let's talk about the cultural issue. I'd like to start from there. Why will people run away from vaccination?
Well, you know that sometime a few years ago, there was an unfortunate episode in the northern part of Nigeria to do with polio vaccination. And that set us back a lot because of cultural beliefs and because of also people feeling that vaccinations are something that is made from abroad and that is not entirely useful in terms of their communities, which we know that that is a total fallacy. And so the only way we can re-educate people in terms of that is actually to use both community leaders, go to the people, use some of the health education campaigns that we're doing.
If the facts we got from WHO is correct, Kwara State right now is like the zero state. That's where it started from in 2017. And the level of vaccination there was between 70 to 80% until we now have responsive vaccination. That was a place that allowed some level of vaccination. Why then do we have an attack coming from that area, an outbreak, so to say, from that area?
It's not really the fact that we have an attack. One thing that people sometimes don't know is that we do have endemic issues in terms of yellow fever. So there are yellow fever incidences that are bubbling under the radar, if you like. And therefore, it's only when then it started, the incidence of yellow fever starts going above what we expect that we'll start worrying about it. So, and of course, the fact remains that if we can reach 100% vaccination, we can, of course, abolish yellow fever because it's something that is preventable with vaccination. But at the moment, yes, Kwara State might have up to 70, 80%,
yes,
but it's a question of how much they have in terms of yellow fever, how much they have across board. And one of the things that I think is a message that is also coming through today from all our exercises, yes, we are concentrating on yellow fever, but actually we would want, both as WAHO, but also as Nigerian CDC, we would want vaccination and immunization to become cost for power, which means that we want it to be part of everyday routine so that we don't have to be having exercises to inform people are vaccinated.
And this vaccination isn't for life?
It is for life.
Okay, all right, good.
So if children are vaccinated after the, or if anybody who hasn't been vaccinated.
And adults can also be vaccinated.
Exactly.
Okay, all right.
Exactly.
So let's talk about the simulation exercise that happened yesterday in Lagos. What's about it?
It didn't happen yesterday. It kicked off yesterday.
Okay,
so it's continuing today and tomorrow until Thursday. Okay. Now, the exercise is really for the three aims of what we're trying to do. First of all, we try to prevent, okay? And in terms of prevention is some of the things that we've been talking about. How do we reduce the possibility of people being bitten by an infected mosquito? So how do you ensure clean environments, mosquito eradication and all that? The second is to prepare in case there is an outbreak, and that's what we're doing. We're trying to test our systems of what would happen when we sign.
By what system? Can we be more specific?
In terms of logistics, in terms of how people react. So, for example, the things that are happening at the moment, and that was at one of the control rooms, is that there are actors who are pretending to have a collapse from yellow fever, having arrived in the country. And so we are then testing what is happening with the people who are at the forefront, the health practitioners, the border staff, health staff. What are they going to do in terms of if suddenly that happens? And then they find that there are many cases scattered around the country. How will they react to it? How will they communicate across West Africa? How will they contact trace? But in terms of contact tracing, remember, we're not looking at it as person-to-person communication because there is nothing like that. But it is actually, there is mosquito vector borne, and therefore the area where they have the mosquitoes and how to reduce that.
Okay, let's stay with the border control thing. WHO gave an advice last year that Nigerians should get certification of people coming in. If you've not been vaccinated, perhaps maybe not allowed into country or some kind of advice. How would you rate Nigeria in terms of compliance to that advice?
Well, actually, the yellow fever certification has been there for a long time. Remember that yellow fever is one of the notifiable things to WHO. What happens, however, is that when the incidence goes above an endemic level, then they immediately say that a country would need to have that certification.
And between that last year and now, what would you say
I would say, I mean, I haven't got the figures in terms of what's happening regarding everybody, but I know that part of the cultural attitudes that we have to change is what I have heard people say, that sometimes you find that the yellow fever certification in terms of the yellow booklet that people have to travel with, it may not be as accurate because sometimes people get the yellow booklet without having the vaccination. And that in itself is something we'll have to change people's attitudes to say that this is a dangerous illness. If you're
so how can you reverse that? We're going out on this interview, but how do you reverse that when all you need to do is present a certification and I have it, but I haven't been vaccinated? How will that be detected?
Well, there are ways of detecting it, but the fact you have to remember is that we are looking at what is the effective measure. It is not effective to use the small financial resources we have to go testing people, because you can test to know whether people have been vaccinated. And that's, again, how we test in terms of diagnosis. We do, however, know that provided those people who issue the yellow cards are themselves the ones that we're educating and we're changing that cultural attitude, then of course the public cannot get it unless a health practitioner issues it to them.
Okay, we'll leave you there. Many thanks for your time and your thought on TVC News, Professor Stanley Okolo.
Thank you so much.
We appreciate that.
Thank you.